Welcome to Inside Exchange, Topics for Manufacturers, a series bringing you expert-led presentations on the issues that matter most to members. The curated topics in this series feature presentations from associate members and subject matter experts through on-demand and live webinars to help Hudson Valley manufacturers. If you have topics you'd like us to explore in future episodes, contact us at info@councilofindustry.org. Let's begin.
Hi, everyone. Thanks for joining us. In this episode, Harold King, President of the Council of Industry, talks with Wes Price, Senior Consultant at Brown & Brown. Brown & Brown is an associate member of the Council of Industry and one of the largest and most respected insurance brokerages in the world. They help businesses manage risk and provide valuable benefits to their employees. In this conversation, Wes and Harold discuss the benefits of joining a medical consortium offered through Brown & Brown and in partnership with the Council of Industry. They discuss how the consortium works, who's eligible to join, and how it can help companies manage healthcare costs while offering quality coverage to their employees. Thanks for tuning in. We hope you find this presentation helpful.
Wes and Harold, thank you so much for talking about this with us today. Why don't we get started by telling us a little bit about yourself and about Brown & Brown?
Sure. Thanks, Johnny Ann. So my name is Wes Price, and I am a senior consultant with Brown & Brown. And the reason I'm here today joining Harold is to talk about a new concept and new opportunity for members, which is a medical plan consortium that we have launched for 2025. And my background includes over 23 years in the insurance industry, working for either on the carrier side or as a broker consultant.
So let's just jump into it. Tell us a little bit about this and what our members should expect and what they should know.
Absolutely. So today we put together an agenda, as you can see here on the screen. We're going to do a quick overview of Brown & Brown. Some of you may know our names. As a large national benefits consultant, we'll do an overview of the consortium concept and what that means. Have a series of questions that I'll run through, which will hopefully answer and provide some good detail about what this opportunity is. And then we'll wrap it up with a quick discussion with Harold with some additional questions and dialogue that, again, the purpose is to introduce this concept and see if it may be an opportunity for your members. So just to jump into it and talk a little bit about Brown & Brown Insurance Services. We are a top 10 insurance brokerage. I think we're at number 6 in the United States currently. We have over 500 locations, offices here in New York State, big presence in New York City, Westchester County. I sit in Albany. We have offices in Syracuse and Rochester. So we're well positioned throughout the state of New York. We were founded in 1939. We have many different aspects of the company, but two of our largest and key components are employee benefits and property and casualty insurance consulting. And our mission is to deliver innovative solutions to our trusted team, driving positive results for our customers at every stage of their growth journey. I wanted to take a moment and really spend the bulk of the time just kind of going through the consortium concept with an overview. So folks, most common question would be, what is a consortium? A consortium is a group of like-minded employers that join together to purchase medical insurance and take advantage of the economies of scale. As we know, we live in a world where medical premiums and the healthcare costs are skyrocketing. So companies are trying to find ways to be innovative, creative, and create more stability and hopefully create an opportunity for more positive results. The consortium can be a fully insured or self-funded. The one we're talking about for the Council of Industry and your members is a fully insured consortium. And when we think about these consortiums, they're really not new. They've been around for many, many, many years. One of the most common industries that they're really popular in is education. Our schools, there's several consortiums across the state of New York, And it's not uncommon for them to have 15 to 25 schools within these consortiums purchasing their medical insurance together. Nonprofits also use consortiums, automobile, construction, and of course, the manufacturing industry. So just to talk a little bit more about our team, we have a lot of experience working within consortiums. Dave Spiegel is a senior vice president on my team. The reason I have him on the slide here is because he actually created and is responsible for working with MACNY, which is a sister association out in central New York, who established a consortium with Dave 7 years ago. And we will talk about MACNY a little bit further down in the slide presentation here when we kind of review a quick case study. Of course, you have myself, who is the lead consultant, overall responsibility for everything that happens, whether it's initial engagement, evaluation, working with the carrier, responsible for all account management, and all the service and support. I bring over 25 years of experience within the industry. And then Nick Bosich, we're lucky enough to have an in-house underwriter, responsible for underwriting and analytics. So he would be the lead underwriter responsible for working with myself and your members when we look at claims data, renewals, and engaging in that important process. So the next question when understanding the consortium is, what are the criteria to participate? Just to keep it simple, for this particular consortium, there's really 2 key things that we're looking at. 1, you need to be a member of the Council of Industry, and 2, you have to have 100 full-time employees. Unfortunately, for this type of consortium, companies that have less than 100 full-time employees and that are currently in the community rated pool would not be eligible. So looking at the actual benefits of the consortium, there's really some great and valuable benefits for companies to take advantage of. As I mentioned earlier, the reason we're really looking at this concept and the reason that it's worked for so many years is because as healthcare costs have continued to rise and trends for healthcare range from 9 to 11% annually, looking at the consortium, keeping in mind that we're pulling the companies together, trying to create economies of scale, we're obviously trying to combat and figure out a way to address those rising costs. We're looking for better renewals, but really it's not just a 1 or 2 year fix. What we're really trying to accomplish is long-term rate stability. We want this to work for 3 to 5 to 7 to 10 years and have better renewals over each year. We're also creating an opportunity for greater predictability. One of the key areas that I think would be of interest to your members that may not be getting any sort of data currently based on group size, it's common that an insurance carrier would not release any sort of data. If you were a group of, say, 110, 120 employees, you may not be seeing any data or limited data. This would allow us an opportunity to provide claims utilization data in aggregate, gives us an opportunity to understand different cost drivers and trends that are affecting the premiums and underwriting. We also don't want to forget about shared services. So as we come together as one, we're going to also keep in mind that we have other components that are involved, including well-being strategies, technology, benefit administration systems, population health consulting, and also dedicated customer service and support. So making sure that your members have kind of that white glove approach when it comes to working with the carrier, but also working with my team as well. So just transitioning over to Brown and Brown again and looking at our experience, common question that we get is, what is Brown and Brown's experience with working within the consortium space? So we really do lead the charge in New York State as one of the brokers that believes in this concept and has proven that it works. So we have 9 consortiums currently. Again, they range from nonprofit to education, construction. We have automobile, and of course, we have manufacturing. So we now have two manufacturing consortiums. One is with the Council of Industry, which is super exciting. Two is with MACNY, as I mentioned earlier in the presentation, the Manufacturing Association of Central New York. What's interesting is when you look at the actual numbers, it's quite shocking. It speaks to the relevance and the success of how a consortium can benefit Council of Industry. So when you look across our current consortiums, we have over 200 employers, 25,000 full-time employees represented, 30,000 contracts, 50,000 total members, and over 200 million in annual premium. So the numbers are really significant when we look at those 9 consortiums. And again, that's just for Brown and Brown. So we have those consortiums are spread across the state between all those offices that I had mentioned. And there's many other consortiums that other brokers and consultants work with as well. So this is not a new concept. We have well over 20 years experience working within this space. As I mentioned earlier, I wanted to talk about MACNY in a little more detail and give you, a case study. Figured this would be the most relevant one since it's a sister association. And this is really what we're trying to work towards with the Council of Industry. So we're just starting off here launching this in 2025. It's up and running. We have current members. But as you can see, MACNY over the last 7 years has grown to 17 companies or members that are participating. There's over 10 million in premium savings that has been tracked and generated over those 7 years. What's more shocking is that it's run very well. And when we average the renewals over the past 7 years, surprisingly, it's as low as 3.5%, which is fabulous. We don't see that very often, but again, it speaks to the value of coming together, pooling, growing to be a larger pool, which helps us with that stability, and also working with the carrier to drive down those renewal rates. We're creating, in this case with MACNY, consistent and favorable loss ratios, again, by spreading that risk so that, groups that may have been running well above 100%, we're seeing the aggregate loss ratio come down to a more favorable number, which again helps the underwriter and also helps the pricing. No plan design modifications. So that's really the key. We don't want to disrupt things. We don't want to disrupt what the company is currently doing today. We've seen consistent annual growth in the enrollment. So it didn't start out with 17 members, of course. Similar to the Council of Industry, we start out small with 2 members or 3 members, and we grow it to 5 to 7. So over the course of the 7 years, every year we've seen, anywhere from 1 to 3 new companies, new members come into the MACNY consortium. And then again, some of those other things that have happened outside of just the insurance is a focus on improving and really aligning well-being, collaboration, working together, talking about, what works for one company or what might not have worked for another. So really having those dynamic conversations has really been one advantage to coming together as a group. Hopefully we've given a good amount of information about the opportunity and what it means to be in a consortium and how it works. But let's transition for a second to, the process for actually evaluating, the option to figure out if it's something that makes sense. Try to simplify it. The first thing is to just connect with myself. We could do it virtually. We could do it in person to talk about your current plan, things like your renewal date, your plan design, of course, talk about your demographics, review the company culture, talk about well-being strategies, really to get an understanding across the board, what have you done? What are you trying to accomplish? If you do have claims data, taking a look at the current claims data and past claims data, and then discussing past renewals, at least looking at the the last 2 to 3 years of renewals. That's the basic information we would talk about in that meeting together. With that information, I would be able to determine if it's a viable option and if we would be ready to take the next step, which is to engage MVP, who is the carrier for the consortium. MVP and Brown and Brown would, of course, review, discuss the information, and ultimately make a decision to present results, and then get back in touch with our members to discuss any next steps. The last bullet talks about really the timings. Our goal is to really meet with, if you're a January 1 renewal, let's say, is to meet with companies starting really now until maybe like June 1st, because ultimately we want to, work through this process, determine, if this is a good fit, but ultimately we don't want to make any changes, any later than 150 days prior to the renewal, because we need to leave it enough time to actually, make this a success and make it a smooth transition. So, so the timing of it is to start early and not wait until later in the year. I know that's the common thing to do, but we'll be reaching out through different modes and outreach to try to connect with those groups that have more than 100 full-time employees to discuss this option and try to run those meetings in the early part of the year here. What options are available? So as you just heard me mention, MVP is the medical carrier. It's just one carrier, so we can't have multiple carriers. But MVP has a strong presence in the Hudson Valley, in the Capital District, really across the whole eastern part of the state. You're allowed to keep the current plan design you have. So that's one question that we often get asked is this limited to a certain number of choices? The answer is no. You keep the plan design that you have and we'll work with that. If you do want to offer multiple medical plans with MVP, that is also an option. So as we look at the current plan design and we look at all the criteria, we could decide to make new options available as well with MVP. So that concludes kind of the middle part of the presentation, which was to really provide an overview on what we're trying to accomplish, the excitement about the consortium, what it means to be in a consortium. And I'll kick it over to Harold now to really have more of a discussion on any questions that he feels members may have.
Perfect. Thanks, Wes. That was really very informative. I think you covered a lot of the important questions that people will have and the definitions and the process and so forth. And also thank you for bringing this to us. That's, as an association, we're always looking for ways to bring value to our members. And while this, because of the 100 employee cutoff, it's not for all of our members, but it is for a significant portion of them. And we really appreciate this opportunity to work with you. And of course, to learn from your mistakes that you already made with Mac. That's we always like that process.
Absolutely.
So actually, just a couple of questions. One is some just background practical stuff. Why is it the 100 employee cutoff? Why is that? Is that a state law or a state regulation?
Yeah, there is other consortiums in the state of New York that are particularly difficult to achieve through what they call Article 47 legislation. And there is those consortiums do exist in the state, and they would go under 100 employees, but the criteria and there isn't very many of them that exist because they're very difficult to build. There's certain criteria that needs to be met. You have to have, for example, I believe 2,000 lives.
Okay.
Just to launch that, and there's a process of going to the state of New York, almost like an application process. So there really is not many of those that exist because it's very difficult to get them launched. So if you don't go that route, the other option that is available is to look at working with an association like the Council of Industry. There has to be one central binding organization. That's the key, Harold, in the state of New York. Council of Industry is that binding entity, and you have a membership, association. So if we have that, that is really the other opportunity for a consortium. But the key there is that it has to be over 100 employees, as we talked about, in order to participate.
I guess that makes sense. New York State does make it difficult. It's one of the reasons why this is so expensive and why this is such a huge issue for our members. I mean, I think it's safe to say that this is one of the most substantial cost centers that all of our members have, and so this is an opportunity to address that in a meaningful, managed way. Um, Talk a little bit about the underwriting, if you would. I mean, so we're not just uh, letting anybody participate. You have a certain commitment to wellness and just like before. I don't want to put words in your mouth. Talk about the underwriting.
Sure. Yeah, no, it's the most critical piece. We want to do this because we want it to work. We want it to be sustainable long term, year over year. This isn't just a 2 to 3 year, trick fix. So to your point, it's critical that we work together, and that's why we know the questions to ask, we know the data that we need to receive up front, and the conversations that need to be had, so that we can go back to MVP and have a good discussion, make sure they have everything that they need to keep it moving, and really, to your point, provide a really good result for us. And in some cases, it may not be there may not be a good fit if a particular member group, is not running well and the claims are significant, or the demographic trends to be, a trend that isn't favorable to underwriting. We would have those conversations, and we would work with one of your members to explain that and understand that. And it's an important process. And what that means is, it doesn't mean that you can't get into the consortium. It could mean that this year it might not work or it doesn't make sense. There could be opportunities to work with Brown and Brown. Believe it or not, we've had situations like this before where we engaged groups. We've engaged our population health team. We've engaged others to try to get a good sense of why the claims maybe are high. If there is ways that we can impact well-being strategies, and get a group into a better position, from an underwriting perspective. So even if someone doesn't get into the consortium this year, doesn't mean that they can't get in next year. So, but to your point, we are very careful about it because we want to protect and try to have a good pool. But I'll tell you this, Harold, we also understand that, nobody is immune to what's going on. The high cost drug, higher cost of healthcare, significant, high claimant costs, mental health, substance abuse. There's several different factors that are contributing in 2025 to the rising cost of healthcare, and nobody's immune to it. So, that's the benefit of this is you might have a bad year this year, but you might have 2 or 3 good years. And someone who's had 2 or 3 good years is going to probably have that bad year. So when we think about that, that's what's really going on. It's uncommon for groups to have 2 or 3 or 4 bad years in a row. And if they do, that's just, it tends to be really, really bad luck. So the underwriting component is critical. Working together and getting engaged, is critical. When you get into the consortium, we certainly hope everybody is a good fit and running well, but we don't want to just, if someone doesn't get in this year, we want to keep the conversation going. We want to figure out how to make it work and get them in, so that we can grow this the right way.
That sounds great. So, why wouldn't somebody want to do this? What would the hesitation for 150, you got 200 employees, you're seeing premium increases 15 to 20%. Why would somebody object to this? Is there some wrinkle?
Yeah, no, great question. On the surface, as far as saving money, creating a better opportunity for the long term, we certainly think that it all makes sense. That there shouldn't be any cons to doing this. But, from a relationship perspective, we do respect and appreciate folks. They do work with probably a broker currently. One of the important things to note is that, Brown and Brown manages this consortium for the Council of Industry. And that is a factor. We respect that somebody would have to make a change to work with Brown and Brown. So we're very careful. We're professionals. We understand that relationship is important. But that would be a key factor, is a change would need to be made to work with Brown and Brown to be in the consortium so that we can, again, manage the entire relationship. So it would not be available to current brokers. This is more proprietary to Brown and Brown. That's really one of the only things that I believe, companies and members, would consider and have to think about, because again, those are important relationships that they may have had for many, many years.
And
Um,
and assuming the MVP network is, adequate and, certainly is servicing the vast majority of our region.
yeah, absolutely. So that would be another one. Looking at MVP again, MVP is a very strong competitor to CDPHP or the Blues within the Hudson Valley, where most of your membership is currently. So MVP in the network shouldn't be a factor. They also use Cigna for a national network through their PO plan options. As many of your members who currently work with MVP will know. So MVP shouldn't be a factor as a carrier, certainly when you talk about the network, but when you talk about their well-being strategies, they really compete and align well, across the board with the other carriers that are in your market. So we have a really good carrier in place, but there could be, to your point, questions related to that as well. But other than that, they're really, it's mostly pros, mostly all pros,
Fair enough.
to at least evaluate it and figure out, is this a fit for, for our company?
Sure. And there's, put these words in your mouth. There's no commitment to ask, right? There's no,
Nope.
to explore it is not committing in any way, shape, or form.
No, using the commitment word, we've really made the commitment to you, Harold, and your members to go along that evaluation process, and we'll know when we get to the point where, it makes sense or it doesn't make sense. And as I discussed, if it makes sense, that would be one of the next steps, is to become the broker of record, for the company, so that we can begin, actually implementation and working through the next steps. But for that very initial stage of evaluation and vetting, if you will, and determining, we're just willing to put that work in to get you to that point when we'll know when we get there.
Appreciate that. And the because it's fully insured, there's no like joint and several liability or anything along those lines. It really is just a mechanism of purchasing your insurance, your health insurance, through this process.
Yep, that's correct. So this doesn't really happen unless there's an acquisition. That's really the only time we've seen it happen. But if someone wanted to leave the consortium, they absolutely could do that upon their next renewal. That would be the typical time. If there was a reason, they certainly could do that. Absolutely.
Gotcha. Okay. Well, this has been very enlightening. We really appreciate it. And again, appreciate you and Dave bringing this to us last year. It is, it is a solution for a certain proportion of our companies in an area where it's a big problem. And we really appreciate the opportunity to set this up and to work with you.
Likewise, Harold, it's been a pleasure to work throughout the greater part of last year to get this kind of in the introduction phase and get this launched. And we agree that the reasons we do this, especially with manufacturing, is we know how difficult it is to navigate the waters, and we need to try to come up with ways to be creative and innovative. It can be difficult in the insurance and employee benefit space. But this is one example of myself and Brown trying to think outside the box, trying to bring a new idea, new concept to the manufacturing members of your association, so that we can give ourselves the best opportunity to combat the rising cost of healthcare.
Appreciate that. So I think you have one more slide there that perhaps has your contact information. So beautiful. So let's leave that for a minute while I thank you one more time for this presentation. And I think it's best for interested parties to reach out directly to Wes. But of course, if you have any questions, before that, or that any comfort level you want to achieve by talking to me or Johnny Ann, we are certainly more than happy to talk and explain the process. Wes, thank you very much. We appreciate your time today.
Thank you, Harold.
Thank you for watching Inside Exchange, Topics for Manufacturers. We hope you found today's episode valuable. To learn more about the Council of Industry and explore additional resources, visit us at councilofindustry.org.